Good afternoon. I am Dr. Edgar Stewart, and welcome to the part 2 of the COVID-19 IDEA and the Delivery of Services in Non-Public Schools webinar. We had a very informative session this morning from 10:30 until 12, where we covered the delivery of related services, FAPE, also learning plans. And we heard from a non-public school and an LEA on, their collaborative efforts in developing their learning plan to support one of our DC students. That session will be, along with this one this afternoon, the recorded audio along with the PowerPoint presentations will be hosted on the OSSE website in the near future. When those get posted, we'll be sure to send that information out to you. So this afternoon, we're going to continue our webinar, and we will be covering a number of different topics, more kind of what I would call the nuts and bolts of some of the kind of concerns that have been raised by you all, educational stakeholders on the non-public side, on the LEA side, and parents, families, and advocates as well. So without further ado, I will jump right in. So as I said, for the next hour and a half or so, we'll be covering a variety of topics related to non-public schools, including safety measures, as I said, delivery of services, attendance reporting, invoice and payment, as well as transportation. So with each of the respective sessions, I'll be introducing my colleagues who will be the subject matter experts in their respective sections. What I'd like to point your attention to, if you look to the handouts breakout box on the GoToWebinar interface, you will see a copy of the presentation to follow along with. You can download it. This is the note-taking version of it. We will, like I said, be uploading the full presentation after the webinar when we publish it to the OSSE website. So please take a look at that. As we go through each of the sections, please feel free to use the question bar to type in questions that you may have, and we'll be going throughout and stopping when there are questions for each of the relevant sections. If you could just use the question bar right now to let me know from a sound check perspective whether you're hearing me fine and there's no audio issues, then we'll proceed. Okay, great. So it looks like I'm getting feedback from you all that you can hear me, so we will proceed. Hopefully you all have already been to the OSSE website, the COVID-19 guidance page. I just wanted to call your attention to areas that we cover with our guidance documents. There's a lot of informative information, and a number of documents are relevant both to general delivery of specialized instruction and related services to students with disabilities, but also several documents, guidance documents that relate to specifically to non-public schools. But overall, on the OSSE guidance document website, what you'll see is information about health and safety resources, educator licensing, including information about waivers during this COVID-19 posture, guiding principles for continuous education, which really kind of lay out the pillars that OSSE envisions that non-public schools and LEAs will be using will have used already to craft their learning plans to support DC students' educational needs. There's also information on the guidance page related to specifically students with disabilities, other vulnerable populations, including homeless students and English language learners as well. Information about the enrollment process as it relates to this kind of COVID-19 posture, as well as information about assessment, data, and accountability. Finally, you will find information about a special education resource hub that I'll be talking about later on at the end of this webinar. That's really a guide for families, written in plain language, answering kind of the kinds of questions that parents and families may have when it comes to understanding and really making use of the resources that are out there with regard to their children's learning. All right, so first, what I wanted to get into was to share with you information about safety measures and reporting requirements. So as a backdrop to kind of looking at safety measures, we know that there are a number of guidelines and recommendations coming out at the federal level, and that each of your respective state and local jurisdictions also have their own guidelines coming from departments of health and education as well. But what we wanted to call your attention to are regulations coming from the COA regulations or the certificate of approval that really kind of help us to think about what OSSE's expectations are for how non-public schools should be, undertaking safety measures. Looking at first DCMR regulation 2801.2, non-public schools shall not be granted or allowed to maintain a COA unless they maintain documentation to verify all applicable fire safety, building code, health, and sanitation requirements. And again, related to that, 2803.2, similarly, that in no case shall any levels be awarded unless non-public schools are able to demonstrate to the satisfaction of OSSE that health safety of their students is protected and that the school is able to implement the provisions in each student's IEP. Really, again, this backdrop, our expectations are that we should be able to see how each non-public school undertakes safety measures to make sure that, all students, including DC students, are safe, and that they're well cared for, and that the school is able to implement, even in this virtual posture, all components of students' IEPs. Also, in terms of making reports of suspected neglect or abuse, even in this virtual posture, it may be that in situations, non-public schools through, virtual instruction are getting windows into, families' homes, and they may see things that, are concerning with regard to suspected abuse or neglect. Again, we remind non-public schools of their obligations for reporting any of that suspected abuse or neglect under 2811.1. Also, non-public schools must ensure that with regard to discipline procedures, that behavior intervention strategies shall be designed to enhance the delivery of IEP support with minimal interruption of the academic program. And really under 2814.2, what this translates to is the school's ability to ensure that even in a virtual posture, behavioral issues that may have been addressed in a in-person environment, that should those behavioral issues impede students' learning, that the school is attentive to them and can work with the LEA to modify a student's behavior intervention plan, even in this virtual posture. And we can talk a little bit about that later on in terms of the kinds of things that may be possible in this virtual posture. And then finally, in the event of a fire or any other form of emergency situation, such as COVID-19 exposure, the non-public school must provide not only to the students sending LEA, but also to OSSE written notification as soon as possible, and status reports thereafter. And this is under 2831.1. Okay, so overall, in terms of OSSE's expectations for how non-public schools should be engaging in their safety measures, the expectation is that non-public schools should ensure that students are safe and available to learn, whatever the situation, whatever the learning, whether it's hybrid learning where students are attending virtually for part of the day or part of the week and also attending in person, or 100% virtual, or as business as usual, 100% in person. Non-public schools should also be ensuring that they're doing ongoing collaboration with LEAs to ensure that students have access to all the technology, equipment, and internet access needed for virtual instruction. And this is an area that we've been hearing, both from non-publics and LEAs about questions about who's responsible for ensuring technology, equipment, and internet access. And the short answer is both the non-public and the LEA. Ultimately, the LEA is responsible, but OSSE's expectation is that non-publics who are granted a certificate of approval from OSSE should have all the resources necessary to ensure that they're able to meet students' IEP needs. So we first expect that the non-public school and the LEA really work together to try and address whatever kinds of equipment and technology access issues are arising, and certainly consult with myself or Yvonne Smith on the non-public invoice payment side as well for additional guidance and consultation. But please, if they're we're in week 2 or 3 at this point, depending on your school calendars, please reach out immediately to your either assigned non-public monitor or to Yvonne Smith or myself if there are technology issues, equipment issues, internet access issues that are still have not been resolved. Because at this point, all students should be able to have whatever technology they need and internet access. So we implore you to reach out immediately if you have outstanding issues. Additionally, the expectation is that each non-public schools is reviewing and applying all the applicable federal, state, and local jurisdiction, Department of Health recommendations and guidelines and how they operate their schools. Later on, we'll highlight some resources that come from DC's version of operating and reopening schools safely, and non-public schools are encouraged to be informed by those documents, but also be having conversations with their LEAs in terms of what makes sense for DC students in the non-public schools environment. Also, partnering with LEAs and parents of DC students to ensure that they are kept abreast of all of the school's mitigation strategies. So, for any of the circumstances where students are coming into the building, or preparing to come into the building, DC students, parents, and the LEA should really have a full breadth of that breadth of that information so that they're able to make plans accordingly and make choices. Per the COA regulations, non-public schools are required to have crisis plans, and now certainly is the opportunity to update those crisis plans to ensure that they're addressing such issues as pandemics that we're going through right now with COVID-19, and make sure if OSSE doesn't already have updated versions of the crisis plans that you send those to your assigned non-public monitor, or you can send them to me, but the preference would be to send them directly to each of your assigned non-public program monitors. Finally, communicating with OSSE frequently to provide us updates of all COVID-related matters, but also more broadly, all COA-related matters, so that we're in the loop and you can access us for seeking guidance. So when it comes to reporting, we're going to talk about this in terms of 2 different levels. With regard to COVID-19 reporting requirements, we're talking about this at the student level for individual students, as well as for at the school level. At the student level, non-public schools are required to report instances of DC students who have contracted COVID-19 using the OSSE incident report module, and the specific incident type would be emergency reporting. There may be other issues going on that might require additional incident reporting, but specifically for students who have contracted COVID-19 and who are DC students, the incident report module should include a incident report where it's flagged as an emergency reporting, and the information in that report should include the student's personally identifiable information, also information about whether the student's parents, the LEA, and any other placing agencies were notified, information that the non-public has facilitated contact between the affected students and their parents. This is an especially important one, especially in residential settings, where students may be far away from their parents, and can imagine it would be a pretty scary thing to hear, to learn that, you know, your child has contracted COVID-19. So being able to make sure that you're able to facilitate contact between the affected student and their parent is especially important. A copy of the incident report should be uploaded to the student's record in the IR module. Also, a description of any safety measures that were put into place. For example, was a student put into quarantine to protect that student and other students from exposure? And then also, finally, information about the student's treatment status, right? So whether they're put into quarantine or isolation, whether they're asymptomatic, whether they're receiving any particular medical treatments that, you know, would be relevant to kind of understand, you know, their general health and safety and well-being. And we remind you that the reporting requirements for this information comes from our COA regulations 2831 and 2836.6. We've got a question here. Is the reporting of COVID-19 positive students only for students receiving in-person instruction? Yes. So at this point, for non-public schools that are only in a virtual posture, we're not asking at this time for information in the incident report module regarding their COVID-19 status. So really, this is for students who are in person, whether it's 1 day a week or, you know, full time, for those students who are going in person only.
Hey, Edgar, this is Yvonne. Can I add to that as well?
Absolutely, please.
Although you won't need to report it as an incident in this incident reporting module, you'll then need to determine, you know, whether the student is available for learning. So you would report it in your attendance. You know, we'll go over that a little later. So even if if you're doing virtual and a student comes down with it, again,
and they're sick though,
like,
right, is what you're saying.
Right.
Not for an asymptomatic student.
Exactly. You would just report it that way. Yeah.
Okay, thank you, Yvonne. Okay, so that is at the student level in terms of reporting requirements. And now we move on to school level reporting requirements. And here again, what we're really interested in is being able to get information about the context with which our students are operating in a particular school. So what this may look like is a facility reporting that, you know, they have 25 students and 50 staff members, and of those 75 individuals, 10 have contracted, have been identified as contracting COVID-19, and 5 of them are students and they've been isolated, you know, in the room. And the 5 staff members who've been identified as contracted COVID are currently not working at the facility, but are on quarantine. So in that kind of situation, what we want to be able to understand is, you know, well, number one, getting a student roster and getting that information helps us to ensure that there's no discrepancy between what our records say and what our databases may say about who's at the facility from DC versus who the school is serving from their side. We also want to know the total number of DC students who are currently placed at the non-public school, the number of individuals, both students and staff, who have tested positive. So this is not just for DC students. This is just in general for the number of individuals. So we're not talking about anything that violates HIPAA, but gives OSSE understanding, as well as LEAs, an understanding of, you know, kind of the current situation with regard to the school's kind of positivity rating rate. In addition, OSSE is also asking that non-public schools describe their mitigation strategies, what they're doing to spread to reduce the spread of the disease. Since this information includes student information in terms of the student roster, it should be uploaded to the non-public schools folders in the box system. And here's a link to that for all of you who don't have that link handy. As you should have received, and I know all of the non-public schools have completed the questionnaire as part of our Part 3 guidance document back in the spring, we want to make sure that we emphasize that going into the 2021 school year, that a similar questionnaire that is embedded in our consolidated guidance document, and the link is here. You'll see that in the third bullet point, that schools complete for the 2021 school year questionnaire that gives us some basic information about their learning plans, their collaboration with LEAs, and also just kind of general information about their operating status and any safety measures that they may be undertaking. And again, we remind you that these reporting requirements also are contained under the COA regulations at 2831 and 2836.1. So as I was sharing before, here are a number of guidance documents. The first three are health and safety guidance for reopening that are contained on the OSSE COVID-19 guidance document webpage. So again, we direct your attention to these. But again, in working with each of your respective LEAs, in understanding things like grouping and school, the number of school days and such, those should be governed by the collaborations that you have with each respective LEA. So while you're informed by these documents, please also make sure that you're collaborating with your LEA to kind of determine what makes sense and what's appropriate for our students in your school within your local jurisdiction. Some additional resources include the DC coronavirus guidance. So this is a general coronavirus webpage for all of DC. So there's additional resources there when it comes to family resources, testing centers, implications for job employment and such, contact tracing that you can also find on the DC government coronavirus resource page. And then finally, we direct your attention to CDC resources on general coronavirus information, as well as information specific to recommendations related to schools and childcare facilities. All right, my colleague Yvonne Smith, who is the manager of the OSSE non-public payment unit, will now present on licensure. But let's just pause for just a minute to see if there's any questions before we move into the licensure section. All right, doesn't seem like we have any at the moment, so let's move on and we can come back to them as they're relevant. Okay, turn it over to you, Yvonne.
Okay, good afternoon, everybody. Okay, so we're going to get into the licensure during this COVID period. As you know, in DC, our mayor issued an order that allowed a waiver of the DC licensure standards, which would have required those people who are providing education to students in DC to have some sort of DC license. But again, in the non-public world, you were allowed to have the license in your jurisdiction to be able to reach our kids. However, the difference between that is because our kids at that time were going to school in your jurisdiction. So with this particular waiver, what it did was allowed you to maintain your licensure status in your own state and provide services to the students in DC. So that's in effect, and it's set to expire in October. However, I just received some word that it's going to be extended to the end of the year. But we do expect that that'll be extended as we continue in this COVID period. So, and basically what our expectations are is that you as providers, that you all maintain and ensure that your license is up to date in your state, and in accordance to whatever your state requirements are. So you'll be required to maintain active license according to your state rules and regulations, and still provide to our students here in DC. Next slide. Okay, these are some of the questions that we've got received from the non-public world.
I see one person says that they can't hear. Oh, okay, I can hear her now. Okay, let's move on. Let's see, because I'm only seeing one person who said that. Okay, go on. Sorry about that.
Okay, no problem. Okay, some additional questions we've received. The executive order also indicated that the waiver is applicable if the healthcare provider has an existing relationship with the patient. So again, that was one of the criteria that came out. But again, in our non-public world, we have different scenarios or different circumstances. So as you're receiving new students, this particular requirement wouldn't apply to you. However, we do require that the schools use the consent for distance learning, virtual learning, whatever you're calling telehealth learning, that as students go from one school to another, that they sign that that consent form. And it is required, even though a student may have one on file. If I'm going to non-public school A, or even starting at my LEA, I have one on file with them. But if I move to a different school, a non-public school, a day school, or whatever, I have to sign it again, because your plan and your process is different from where I came from. So you have to review that with the parent and the student and have that signed again. And then each time the student changes schools, they'll have to sign it again. And I know that might sound a little burdensome, but it does make sense because everybody's doing things differently. And you have to get that consent from the parent and or the adult student as you're changing modalities and learning plans and such and such. Okay, the next question is, during this COVID period, will DC allow a related service provider to provide services to a DC student in another state other than DC? We've had that scenario come up. For example, a student went to New York, and because we're in this virtual mode, you know, the chances are that you won't even know that that took place. So I don't know how the non-public school did find out that the student was in New York at the time. However, we're saying when that happens, you'll have to check into what are the regulations for that state that the student went to see if that would be allowable according to their regulations. So, I mean, again, you got to keep communicating with your parents as things change and they have to move. We want to be aware of that, because we don't want anything, none of this education or all your efforts to be nullified because we weren't aware where the student is and there might be some changes from state to state. Next slide.
Yvonne, a question came in. When it was shared that the waiver is expected to be extended through the end of the year, is that the end of the calendar year or the end of the school year in June?
No, we'll provide you with more information on that. I just saw an email come through that it was being extended, but I haven't looked at it yet. So, but we'll put some information out there so you'll know that specifically.
Okay, thank you.
Okay, so now another question?
No, go ahead.
Okay, so now we're going to go into attendance and SEDS and payments and invoice submissions here. So first of all, in the 2020 school year, it's OSSE's expectation that we really try to operate business as usual as much as it is possible. So with that, at the beginning of COVID, we kind of relaxed the attendance reporting requirements, but now, again, like I said, business as usual, and we're expecting you to take daily attendance. So with that, you all should have been using the COVID codes that we created in the beginning of the year. And Edgar, if you could show that slide. We've created and added a new code to try to accommodate.
Can you see it? I just want to make sure you can see it.
Yep.
Okay,
to accommodate all the different scenarios that could happen. So these are the codes that you will be using while we're in this COVID period. It doesn't matter if your school is serving students in person or not, because we're in the COVID period. And we're using these codes for different reasons, you know, to track COVID and what's going on, and to be able to differentiate from that any different scenario. So you would use PE when your school is closed, meaning the building is fully closed, nobody's in the building, and education services were not being provided. So this would have been at the beginning of March, you know, when everybody kind of closed down for maybe a week or two. And everybody was closed because of COVID and while we were trying to figure that out. So that was a code you would have used in the beginning of the COVID period. I don't expect to see that come back, or I'm praying that we don't have to use that again if there's a resurgence in our directives for COVID. The second code, HE, is to be used when a student is present. The non-public school building is still closed, but now we've kind of put some variables in here because as we're moving to different phases, this is equivalent to the student is present. So whether your building is closed and you're doing virtual, or your school is open, or you're doing virtual, you're doing hybrid, you're doing in person, all we're denoting is that we're in COVID and the student was present. The next code is an excused absence, same scenario. Whatever modality you're in, the student has an excused absence, and the excused absence is still according to the established absence rules, you know, 6, hospitalized, you know, they have a note or whatever excused absences they may have, again, in accordance with the already established excused absence rules. The next one is the EA code. Oh, excuse me, that was the excuse. Now we've added one for unexcused absences. This is UX. And again, this is, you know, whatever modality you're in, the student was absent, unexcused. No contact with the student has been made. You don't know why they're absent, or even if you have and they don't have a proper reason for being absent. Again, according to the already established codes for unexcused absence, you would use that. And then the only other code we're using that is not a COVID related is the U code. And that would be used on days where if you're having school breaks, if you're having teacher only development days, these were days where, you know, your school is closed to the students. But you all are operating as staff in whatever mode you may be. Okay.
All right, I'm going to switch back. Okay.
Okay, no questions about attendance?
No,
Again, like I said, okay, so you all should be used to that. The only new one is the UX for excuse, and we're changing the UX is unexcused, and we're changing the use of the excuse to just a regular excuse. So again, business as usual, you're expected to report daily attendance. And if any of you were on the session 1 webinar, we had a good conversation between an LEA and a non-public, and they shared how a creative way to take attendance in this COVID world where you have kids in this cohort or that cohort or whatever, or on this Zoom line and that Zoom line, a good way to record attendance. Next slide. Okay, so again, in line with that, as we go on, we know that students may miss services or you might have to make up a service. Again, this is the expectation is that it's business as usual. You would record this in SEDS. You would first mark that the student was unavailable according to any of the standards that are available there. Student not available or student absent. And you know, the difference between the two, a student absent is they just didn't show up, but a student not available could be that, you know, maybe their technology broke down, you know, or something like that. So, you know, or even if they were sick, you could put that they were not available. But in here, again, you're expected to follow the normal SEDS protocol for entering missed services and or makeup services. So you would put whether or not the student was available. You will put whether you attempted the service, delivered the service, or not delivered the service. The hours and minutes would be whatever the session was supposed to be. If it was an hour of speech and they missed an hour of speech, you would put 1 hour in there. And then you should put a decent note in there to try as best as you can to describe what's going on. It doesn't have to be a book, you know, just get to the point and put some notes in here. Also, while we're doing these missed and makeup services here, you're also supposed to put in there the modality that you're providing the services with. So if this was supposed to be a virtual session, you would also put this was a virtual session in there. Next slide. Same thing, makeup, you would just mark that right there if you see on the left margin that this was a makeup service. So if you missed a service and you were able to work with the parent and the student to determine another date to provide the service, it would go in as a makeup service and you would still complete all of the applicable boxes in here as well. Next slide. Okay, so I'm very, very excited that during this COVID pushed us to create an online invoice submission process. Because of COVID and the closure of the DC government buildings, we couldn't guarantee that we would receive your invoices via US mail or even courier services. So we were able to put together an FTP box that you can go right online. It's really simple and you can submit your invoices. Some of the issues that we've run into with this is that you're submitting invoices a page at a time as different documents. We suggest that you scan the documents all together as one document. You would have your invoice, your attendance, and your cover sheet, and any other documentation you want to include there. Scan it together as one document and upload it together. Also, if you're doing revisions, please mark it as a revised invoice, and we will get all that information instantaneously. So at this time, we're asking everybody to use this FTP box. It'll remain in effect, even when COVID goes away. But right now, everybody is required to use the FTP, again, because we cannot guarantee acceptance of your invoice sent in any other manner. Okay, next slide. Okay, so funding and payment during this COVID period. So unless OSSE has advised you otherwise, we will continue to pay for tuition and related services in accordance to the rules we have basically established. Again, it's business as usual with a few different additional requirements. So the additional requirements are, number one, the LEA of each of your enrolled students must complete and submit an LEA request for payment on behalf of your non-public school. Each non-public school is required to create a learning plan, and they should submit that learning plan to both the LEA and OSSE. You can get it to my team or to Edgar's team. Again, we got these box protocols. Edgar requires you to send it to the box. If you're sending it to me, you can send it to me via email or through the through our box. And then Edgar mentioned the questionnaire. So even though you've done some of this before, we're in a new school year, and you've probably updated your plan, and you're probably doing things a little better than you were before. So you have to do it again, regardless of whether you did it before or previously or whatever. This is the new school year, so you have to tell us what your new plan is. And at this point, you will not be able to receive payment unless my team, my payment team, has received this LEA request for payment. LEAs, for the LEAs that might be on the line, the learning plan should be sent to the LEA. And the intention of this was to foster collaboration between the non-public schools and the LEAs. As you know, I mean, you all should be communicating throughout the year anyway, but during this COVID period, it may necessitate a little more communication. So what the ideal plan for this is, the non-public school creates a learning plan. They submit it to the LEA. The LEA and the non-public school meet. They discuss and walk through the learning plan. And if everything looks good and we're all in agreement that the plan will work for their specific students, then the LEA will complete the payment form and submit it to OSSE. Now, this is the other caveat to this is that if in your learning plan, non-public schools, you're saying that I'm providing virtual, for example, virtual learning to maybe October 31st, the LEA payment form should only authorize payment until October 31st. And the reason for this is that after October 31st, if non-public, your learning plan changes, you must go through this again. You'll have to submit a new learning plan and share it with the LEA and OSSE. And again, you go through this process, and the LEA will submit another payment form based on your new learning modality. So as learning modalities change, you'll have to do these two steps over again. And, you know, if you think about it, it makes sense because you're changing the mode of learning that you're providing to the students. So again, to foster the communication between the non-public school and the LEA, everyone will be on the same page as to what's going on, and that's how payment should be properly approved. The service logs and SEDS, again, every related service session must go in SEDS. This is nothing new. This will be definitely enforced. I know you've heard from my team, and they're still looking for your service trackers to be in SEDS. Again, during this COVID period, we're asking you to indicate in your notes what type of modality you use, whether it was virtual, in person, or, you know, on that particular day. So please just add one simple note to describe that. The attendance logs, again, must be included with every invoice. And, you know, as you all move to use seats, if you're using seats and for whatever reason you didn't include your attendance, well, at least we will have access to it in seats. So you can help yourself by using seats. It's easy to print out the attendance and submit it with your invoice, and or if you don't have it, we'll be able to access it in seats. So everybody should be using seats. And currently we're completing our annual OSSE rate reviews. Again, that's another requirement. No non-public school will be able to receive payment from OSSE until your 2021 rate review has been completed and you have received an OSSE rate confirmation. Okay, so any questions regarding that?
I don't have any at this time, Yvonne.
Okay, I'll get 20 questions after the webinar though. Okay, so this again, new for this COVID period is the consent for telehealth services. Again, many of you have already have this documented in your own format. OSSE did create a template that you can use if needed, but if you have your own template, that's okay as well. So these were the different ways that you could receive consent. Again, given this COVID environment and everyone's different internet or capabilities, you can put it in the service tracker. In your notes, if it was for whatever reason you didn't get the parent to sign the document, but you did get a verbal before you started for the first time the service session, you could put in there, this session was provided virtually and the parent did provide consent for the virtual services. You can obtain the consent via email, and that's just the message. I provide consent for telehealth services and or education. Text messages, you can use the OSSE form, and you can do the verbal conversation. However, if you're taking a verbal consent, you, the non-public, will have to document it so that all of this has to go up into the student's file in SEDS as a document in their file. We have to have that for every student. And again, as students change schools, you'll have to obtain the consent again because you might, probably your learning plan is different. And then one thing to note, that this consent is a one-time consent while that student is at your school. You don't have to keep getting it every school year or whatever. This is a one-time consent while the student is at your school. But then remember, just like consent, as a parent or student can give consent, they can also deny consent. So if anything changes and the parent or student no longer wants to participate that way, you should have them complete the form again to denote that they deny consent. This not only covers you as a non-public school with any, missed services or any changes of heart later down the road, but it documents that the parent did have a change of mind and you want to get that signature on file as well. Next slide.
Question.
Mm-hmm.
How do you take students who are no longer enrolled off of the attendance list?
Okay, that's a whole data process. So as students are discharged from the non-public perspective, when a student is discharged, the LEA will go into SEDS and remove the student from your purview in SEDS. The student will no longer show up on your aggregate file to access his file. And when the LEA does that, and it will drop the student off of the seats roster. So the LEA's information system speaks to SEDS and SEDS speaks to seats. And that's how the rosters are loaded. So as students are coming and going, you'll have to go through that process of getting access to the student and seats. And as those change takes place, those systems talk to each other to change the roster. If you're having problems with that, again, you can always call the seats helpline, but you should also just check with your LEA to see if that change has been made. And in the meantime, while you're waiting for it to drop, you can use the W code, which means withdraw. So that's one of the codes you can still utilize in seats other than the COVID codes.
So what I would add to that, Yvonne, would be that since an LEA asked a non-public asked the question, just as you said, you know, the first step would be contacting the student's LEA to request that they update the student's attending school code, which will then feed into SEDS into seats. And if after a period of time, you know, that doesn't seem to have happened, send another email to the LEA copying both your OSSE non-public program monitor from my team, that's Sherry Pope Black, Tony Lemons, or LaShonda Wilson. You can feel free to copy me as well, and copy Yvonne's team. Who would you want copied on your team, Yvonne?
That would be Jackie Corsi, who's our liaison for seats.
Okay.
But again, you can, if you can't remember, you can always copy me. So again, we can work between Edgar's team and my team. We can work to help you resolve these types of issues. If you're not having success on your own.
Exactly. And it shouldn't be that students remain on your caseload for months after the student has disenrolled from your school, is no longer attending. Okay, next slide.
Okay.
All right, before we move into transportation, and Jason Campbell will kind of take us through the transportation information. He's the Associate Director of the Audit and Compliance team here at the Division of Student Transportation. I want to see if there's any more questions in the areas that Yvonne covered. Okay, I have one question. In regards to the waiver for out-of-state practitioners to treat students in DC, for new students to us, we are required to have an established relationship with the student before we can see them via telehealth. When we asked the DC OT board, we were informed that the students needed to have been our students before the waiver was put in place, which was in March. Otherwise, we would need a DC license to see them via telehealth. Do you have other documentation that will allow us to establish a relationship in another format so we can treat via telehealth? Yvonne, do you have anything for that question?
No, I think, right, hold on. Okay, I'm not on mute. That's a first that I've heard that. So you'll have to allow us to take a look at us, because again, as I shared in this session, that you all, because of the nature of a non-public school and students can move, you know, in and out pretty frequently, that as long as you had that consent for the telehealth or your academic provisions, that would suffice. So we'll take that question back and get back to you, because that's something new that I'm hearing.
Yeah, and I also think that, you know, the original guidance, you know, coming out of the mayor's office and the city administrator kind of took into account like where we were midstream in the school year last year, right? So it made sense that providers had existing relationships. Now going into a new school year, very much so is the time we see, you know, a lot of transition, like Yvonne was saying, where students transition into or out of, you know, various non-public schools. So, you know, we'll take that information back, but I think that, you know, at this year, we'll have to really think creatively about that one, because there certainly will be lots of new students who are going into new non-public situations who may have not had a previous relationship with a provider. So we'll get back to you on that. Next question. If the student comes to Maryland for an initial visit, that can establish an existing relationship. So that's one non-public's, I think, kind of advice or guidance. So, I mean, I think intuitively that makes sense, and that might be something that in Maryland has already been established at the state level. But you know, we'll take that into account as we get more information out to you all about kind of the current stance of this. Next question. Do you have guidance regarding next steps if a student is located in a location where licensure regulations do not allow related services to be provided? I'd say short answer is no. we'd have to get
Right,
back to you on that one as well.
right. So it's just for clarification, you're saying, say the student is in New York, but New York doesn't allow this waiver. What would you do?
Yeah, and that's exactly it.
Yeah.
No, and,
Mhm.
and because it's all predicated upon the provider in that location having a valid license to enable them to practice it whatever way that that board says is appropriate. So, I think what we would ask is if you could follow up with Yvonne and myself with more specifics about, which the student, the state, and what services, this is an issue for, and we can kind of work with you to figure out an answer for that. I suspect that what this is going to really entail is kind of case by case basis based upon, the particular jurisdiction.
Correct. Yeah. Also, are there any other questions I wanted to just?
That's it.
Okay, I also wanted to remind you all that, again, we're trying to operate business as usual as much as we can during this COVID period, and that includes residency. So this is also residency season. Non-public schools, please remember that non-public students also have to prove residency each year. So they can provide documents to you as they're attending non-public schools, or they can send it to their LEA. But it must be completed for every student, no matter what school you're attending. So that is still a requirement, and I believe the residency deadline has been pushed out to November due to COVID, but just remember that it's still a requirement for all non-public attendance students as well.
Okay, so it looks like there's no more questions in the Yvonne section, so we'll move on. So I said Jason Campbell, again, works in the Division of Student Transportation. He's going to take us through several more slides. Jason.
All right, good afternoon, everyone. Thank you, Dr. Stewart, and thank you, Ms. Smith, as well. And really quick, before I get started, just to let everyone know, I am being joined today by two of my colleagues, Jacqueline Paisley Ojikutu, our Strategic Planning Officer, as well as Donisha Cruz. She is our Customer Engagement Manager, and they will be correcting me, chiming in when necessary, also available at the end to help answer some questions if there are any. And again, thank you, Dr. Stewart, for inviting us to present for the non-public teams here today. One of the things that we had been working on quite diligently over the summer was kind of looking at our systems and our processes and seeing what needed to be adjusted, what updates needed to be made, what changes had to be done in order for us to accommodate what the school year was going to look like. And Jackie, one of the things that she's obviously worked on has been working with our vendors and our systems to make sure our systems are prepared to accommodate data submissions in a fashion that we have not necessarily been used to. And so over the summer, some of the information that we shared with our LEA partners, we want to also bring with you today along with some updates and just kind of provide some guidance when it comes to transportation for students that are going to be attending in any in-person educational service. So we want to start off with some considerations and decisions for the school year, and mainly at the student level, looking at student assignments. How might students be assigned to a particular schedule, and what days would they be expected to be in school? So obviously the format or the platform or the mode of how they'll be learning this year is extremely important when it comes to transportation. Obviously, when you look at in-person or hybrid services versus fully virtual, when you have the in-person and hybrid, there is some form of in-person services. And so if the students that will be receiving any form of in-person services are eligible for transportation, we got to begin looking at what days of the week they'll be needed to be in the classroom, because ultimately those are going to be the days that they need our support. Also at the student level, we want to make sure that LEAs and schools are prioritizing the service preparations and data submissions for the students with disabilities, not just from a transportation perspective, but the related services that are received by students with disabilities are a bit more extensive and take a little bit longer to set up. So while we ask that those be prioritized, obviously we're looking at making sure the required school calendars are submitted from your part. We know that from the non-public team at this point in time, their primary responsibility when it comes to data submissions are the school calendars. And in that, we want to make sure that we're including what the first day of in-person service would be. For example, we know that many schools begin the year virtually, and at some point, whether it's after the first quarter or after the first semester, they will be reevaluating and determining whether or not in-person service will begin. And so with those school submissions, we want to know as best we can when those in-person services would be beginning. And just a few notes before we just get into kind of our time frame. Obviously, if the considerations and decisions are delayed into the transportation preparation time frame, we ask the LEAs as well as non-public schools consider and prepare to utilize parent or LEA reimbursement options. And we'll get into the transportation preparation timeframe on the next slide. And then lastly, if the LEA or the non-public school is not offering in-person services for students with disabilities, then no action is required. We just want to make sure that that's clear. If you continue to operate virtually and there is no form of in-person or hybrid instruction to students eligible for transportation, then no action is required from your part. Okay. And so what we're looking at here was kind of a calendar. We call them sample dates now, but these dates worked with Jackie and her team as well as our vendors to make sure that we had some dates in line over the summer to share with LEAs so that we can kind of be as transparent as possible and show kind of the time frame that we need to begin providing services. On a typical year, our deadline for data submissions is the first Monday in June, and that gives us roughly 2.5 months to prepare services. And while that is a lot of time, we typically see, over 3,500 transportation requests going to, over 150 different schools. And so that level of coordination does take some time when you consider all of the things that we need to do internally, whether it's data verification, system configuration, data transfers, routing development, quality assurance process, route assignments, practice routes, et cetera, as well as our different forms of communications that we've ramped up in the past few years. What we wanted to do was we wanted to look at our time frame for that 2.5 months and see how quickly we can turn things around, because we understand that in preparation for the start of this school, which we still are in for many schools, decisions are going to have to be made fairly quick. And we're going to be looking at some shorter turnaround times. But what we wanted to do was be proactive and look at that time frame and cut it down as much as we could, considering that we would possibly not be working with our normal volume at any given point in time, but rather a smaller subset of schools and LEAs that would be getting started throughout the early months of this fall. So this is really to share some key operational processes, which I've already mentioned, for teams to make note of when thinking about and preparing for offering in-person services. So obviously, the LEA and the schools are responsible for submitting the calendars. Predominantly, the LEA is obviously for the transportation requests. But what we wanted to share was kind of what it looked like from a transportation perspective. and the process of going through the data verification, the data transfers, routing, QA, route assignments, practice routes, all communication. And in addition to that, we have some, additional obstacles that we have been faced with and since have overcome, but calling our staff back. Our staff operates under collective bargaining agreements, and we have 2 collective bargaining units that we work with for our drivers and attendants. And it was new territory for us in that we did not feel we were calling them back to work because they were all technically working. However, the guidelines and the powers that be deemed that we had to go through a process of calling them back. So there is now an additional time frame that we require in order to call back and return staff to our bus terminals in order to provide service. And so, fortunately for us, that time frame is able to overlay a lot of the other activities that we have looked at that we continue to need to do to prepare services. So we are fortunate there. And so where we landed was 20 business days or 4 weeks prior to your anticipated start of providing in-person services is when we would need to know. We would need our data submissions by then. We would need the calendars as well as the transportation requests in order for us to ensure that we can provide service on the first day. And again, if you remember on the previous slide when I mentioned that if the decisions and turnaround times are delayed on the school or LEA end, we ask that you prepare to utilize LEA or parent reimbursement until such time as transportation would be up and running based on the submission of the transportation request form as well as the school calendars.
Jason?
Yes.
There's a question that came in just about that specifically. Can you say more about the LEA reimbursement option and whether this pertains to students attending a non-public school?
So it does pertain to students attending a non-public school. What I will need to get clarification on is if that LEA reimbursement would be extended to the non-public school specifically to be reimbursed. I do know that we, can reimburse the LEA, but I would just need to clarification that if the non-public school wanted to provide the service and seek reimbursement, that is something we can do as well.
Okay, so that's one of the questions that we'll get back to you while.
Sure.
Great, thank you.
No problem.
Anything else on this slide, Jason?
No, that's pretty much it for this slide.
Jason, can I just add, this is Yvonne Smith. Again, from a payment perspective, when we get to that point where anyone's going back in person, we wouldn't expect you to, for attendance sakes, to mark a student absent due to the lack of transportation. Given what Jason has just outlined for you, we're asking that you be really diligent and try to plan ahead as much as you can. I know that some of these decisions to open up from our states are, handled on the fly, but you have to utilize that 20-day leadway from whenever you are notified that you can open up before transportation starts. And when Jason gets back to you to let you know if LEAs can be reimbursed, again, we're just encouraging you to use whatever, parent or school or whatever reimbursements that can be utilized until the bus is up and running. So again, my point is we don't expect to see T for transportation in your absence logs.
Thank you for that. Thank you for that, Yvonne. That's extremely important, and I'm glad you added that. Just kind of moving on to provide some updates on what we have done since the summer and kind of what we have been working on, outside of all of the technical stuff that Jackie and our data team, as well as our outreach teams have been doing to prepare when we want to talk about systems and we talk about communications. One of the things, communication pieces that we developed this year was a bus safety kit. And this bus safety kit, highlights the internal measures that we have implemented to protect safety and well-being of our students, staff, and the communities that we serve. We wanted to make sure that everyone understands that we understand completely that, you know, the space that we're in is going to require a lot more effort and a lot more transparency in the work that we're doing to frankly fight the spread of COVID. And so some of the things that we have done include, you know, outlining a cleaning process for our buses daily. You know, our focus is on the avoidance of infection, you know, while students and staff are in transit. And so, you know, we have kind of built up, so to speak, the bus cleaning and disinfecting process to fall within CDC guidelines of passenger vehicles, specifically school buses, to make sure that daily there is a process for disinfecting between runs, and then at the end of each day, disinfecting on a larger scale. One of the other things we're doing is utilizing internal and external resources to ensure all stakeholders are educated and informed of any information as we navigate our way through our new normal. And so, as I said before, this bus safety kit has been created. It's available on the DOT website. And we are keeping our ear very close to transportation standards, as well as CDC recommendations and guidelines on how to operate amid the pandemic that we are still in. And then as an additional note, we wanted to make sure that we've shared with everyone so that there was no surprise before the yellow school buses really begin rolling again, is that we've gone through a division rebranding. Our buses used to read District of Columbia Public Schools. And for those of you that don't know, years ago, the Division of Student Transportation was run DC Public Schools, but we have since moved on from that, and we have finally, I guess, gotten around to rebranding the buses to say District of Columbia Student Transportation. And we do kind of see this branding effort, you know, as a small reflection of the changes that we've made to better communicate stakeholder representation and to serve the teams and the families that we support and serve. So again, that bus safety kit is available on our website. It talks a lot about school, and it talks a lot about, parent responsibility when it comes to sending your child to school. If your child is sick, they should not be sent into school, because we kind of understand, hey, the school day does kind of begin with us. So, you know, we want to make sure we are communicating to the parents to make sure that they're doing the right thing by making sure that if their student is sick or their child is sick on the day, don't send them to school, and make sure they follow up and take the proper precautions and visits that they need to take. Were there any questions on this slide, Dr. Stewart?
Yeah, there was a few. I'm going to go back to one question on the previous slide. Okay. One question was for this 20 days, I think it's for this here, was that calendar days or business days? So what we see here, this is only this, that 20 days was reported. So yes, it's business days. Okay.
Yes. So 4 weeks is what we're looking at, and that's when we really want to know, or really want to have the calendar submitted, as well as the transportation request forms. LEAs are working with non-publics. The non-publics primarily enter the calendar so that the LEAs can enter their transportation request forms. So that just kind of heightens the level of communication and partnership we want to make sure that you have with your LEAs, that you support as well. And this is not anything new to them. Obviously, this has been shared with them numerous times, and we're actually going to be kind of reminding them of this probably this week with another set of communication to go out. But yes, this is 20 business days. Now, obviously, again, we recognize where we are, and we recognize that some turnarounds might be quicker than others. And so I say that to say, when we see or hear of a, let's say, a calendar submission that is not 20, it's not more than 20 days out, and we're looking at, you know, maybe half of that. Definitely expect to receive a call from a member of transportation, because what we want to do is we want to reach out. We want to make sure you're supported as best we can. We want to, you know, really look at the situation that we're dealing with. And when I say that, we really want to look at the volume that we're dealing with, to see what type of, if any other exceptions can be made. And then obviously to make sure that if we cannot make any of those exceptions, that we do provide the parent reimbursement as well as the LEA reimbursement packages for you.
Okay, thank you. There's a couple of other questions that have come in also.
Sure.
Are bus staff going to be trained in managing behaviors when it comes to wearing masks? Many of our students have oppositional or defiant behaviors, and bus staff have gotten into multiple power struggles in the past.
So that's an excellent question, because obviously we think of the students that we do transport, and making sure that we can support them as best we can. So one of the things we do, you know, anticipate is possibly reaching a point where we do experience a student that is not comfortable with wearing a mask or is refusing to wearing a mask. And one of the things that, you know, several things that we've done in preparation for this is put our staff through some training over these summer months, for helping to re-engage students into the school world, back onto the bus, first of all, and then into the in-person school world as well. You know, so kind of, you know, making sure that we are, you know, approaching this with the correct mindset, that we're there to support and we're there to assist and help. And so our staff has gone through some social emotional training, supports, as well as some re-engagement training, and to kind of best prepare them for what this might look like. Now for the actual, you know, the actual act of not wearing the mask currently, you know, there's a requirement that all students wear a mask in order to board the bus and ride. And so, you know, we will be working with our families and LEAs, as well as our schools, very closely when we do encounter a student where it is a bit more difficult for compliance on that end. And making sure that everyone understands the reason why that is the case, right? The reason why that is the case is because it is that requirement. And now what we also want to make sure that we become aware of is when there are any medical exclusions or any medical conditions that would exclude a student from that requirement. Because in the event there is, what we want to do is, from a transportation standpoint, is revisit the logistics and make sure that the student is still being supported in the most effective way, as well as the other students that are scheduled to ride with that student. There may be a need to reconfigure the route so that that student is on board with less students. I don't know. You know, that would be something that we would look into once we encounter those medical exceptions. But as I say that, just want to also, you know, make sure that, you know, I do communicate that the plan this year is obviously to have buses with a capacity limit of individuals on the bus, to ensure that we are doing our best to social distance on a school bus, even though you can imagine how difficult that is, as well as completing pickups and drop-offs in a specific order in order for the boarding and disembarking of the bus to minimize any student interaction. So to give you an idea what that looks like, in the morning on the way to school, the first student would be picked up and would be seated at the rearmost available seat in the bus. And then once the next student is picked up, they will be sitting at the second most further back seat on the bus, so that they would have limited interaction with the students that were picked up before them. We would also be employing a Z-style seating, so it'll be alternating sides of the bus and rows. And our capacity, I believe, is at 7 people per bus. So that information is contained in our bus kit as well. So please definitely take the time to read that.
Okay, great. I'm guessing that the next question may be contained in there as well. Are you doing temperature checks before students get on the bus? If the student comes to school with a fever and the school is unable to admit the student, will the bus be bringing the student back home?
So that's a great question. Currently, our staff is not set up to provide temperature checks for students prior to getting on the bus. I believe that there may need to be, if that is something that is still being discussed, I'm not aware of at this point. But our staff is not currently set up to provide temperature checks on the school prior to getting on the school bus. With regards to when the student arrives at school, if there's going to be a temperature check completed when the student is at school, we would be asking LEAs and schools to contact the parent for immediate follow-up. Obviously, if there's a check, we wouldn't be, or obviously
Staying to wait for that.
Right, exactly. So we would be asking that the parent be contacted for immediate follow-up there, and then to follow, whatever the guidelines that may be in place for that.
Okay, next question. Who would be the best person to contact for assistance when entering a hybrid schedule in TOTE?
We can definitely get to that. Actually, if we could advance the slides. Just 1, 2 more, I believe.
Okay, all right.
I believe the next slide begins to talk about TOTE. Yeah, so that information is right at the bottom of the screen there. We are still monitoring our phones as well as email, so the TOTE support team can be reached, 202-576-5520, as well as dot.data@dc.gov. And while we're on this, obviously we are continuing to provide training. So Jackie did our system configuration updates in an accelerated fashion this early this summer, so that our systems are able to receive this information in its unconventional way, so to speak, as well as talk to our other systems and make sure our other systems understand the language that we're speaking there. And primarily that system is our routing system. So obviously we know we have a TOTE system where it's forward facing for users to enter calendars as well as transportation request forms. And then internally, when I talk about those internal things that we have to do, one of the things is a data transfer. So we have to move that data to our routing system in order to complete our routing activities. And so as a result, we did, of the work Jackie did, we were unable, we didn't skip a beat in offering our trainings. We offered our training in the old fashion all the way up until those updates were made, and instantly changed gears and continued to offer training in that incorporated the new configuration changes and any changes that users would be able to see. And one other thing that I want to definitely bring up is Jackie also worked with the team to go virtual with our training prior to March. And so we had already been prepared to offer training virtual kind of before we hit the pause button with all of this. And so we've been able to successfully and seamlessly continue providing training. And so, training is continuing to be offered, and we employ them, in anticipation of when you do begin to offer in-person services, or as soon as possible, so to speak, to sign up for training so that you're prepared, and so that you understand and you kind of know what it's going to look like. You could always call the TOTE support team for assistance as well, and they can definitely help guide to see what that looks like. Jackie, I'm not sure if there's anything else you wanted to share regarding TOPE or the training, or maybe what users can possibly expect.
So thank you, Jason. I think you covered a lot of it. Like Jason talked about the trainings, we continuously have ongoing training. We are adding a field also to track your in-person date, so that should be coming as well as you're creating your calendars, so that we ask until that field is in the system that you just notify the data and tech team at dot.data or the TOTE support line. But you can put your calendars in, and then we will continue to work with your LEAs to make sure that the transportation requests are submitted on time.
Okay, Jason, I just wanted to flag for you. I don't think we need to answer this. I don't think we're going to really get an answer for this question here at this moment. But another non-public kind of revisited and said, is there any way to revisit the ability for the school bus to be able to transport a sick student back home? Obviously, this can be problematic as parents frequently do not answer the phone or have a way to come up to pick up a student. I mean, unless you have additional specific guidance on that, that might be just a question kind of given, like, the immediate nature of, the public health epidemic, just a student potentially, symptomatic student, in the non-public space needing to get picked up. I just wanted to flag that for you so that maybe we can kind of do some more thinking about that in more detail, and then get back to our stakeholders at when we look at the rest of the questions.
Sure, we absolutely can, and I mean, I think it's definitely worth talking. We want to make sure that everyone's comfortable in kind of where we are, and to that also, I want to make sure we include in the conversation what supports we're giving parents at home to complete these checks prior to the students getting on the bus. And that's, obviously a much larger conversation that we want to, have with some other teams at OSSE, LEAs, and including non-pubs, right? We want to make sure that, we're supporting families as best we can. And, and at the same time, as we continue to fight the spread of COVID, how are we going to support parents to maybe do those checks at home, right? So that, we get less checks at school and that require additional follow-up supports, right? So, making sure we're communicating and providing our families with the resources that they need to do these things at the start of every day. So yeah, absolutely. You can definitely make note of.
Great. We'll follow up as we broaden that conversation. Last question in the interest of time. We've got just a couple minutes left. Yvonne, this question is for you. The consent to receive telehealth services, is this required for all DC students or just those receiving related services?
Well, again, for telehealth, for related services, you can fill out that form. All students who have related services must have that form. But you as a non-public and some of the LEAs are providing the same for your academic work as well. So they can be one in the same, one form for both avenues. So
at the very least, it needs to be for related services.
Exactly.
Okay. All right. And that brings us to the close of this part 2 of our webinar session. Again, here is the contact information for Yvonne Smith, Jason Campbell, and myself. As I shared with you before, the OSSE webpage includes the guidance on all of the guidance documents published by OSSE in the last 6-7 months, as well as I was sharing with you before, the Special Education Resources Hub. And this is an excellent resource to point your families to in terms of, what things that they may need to know in terms of, their child's education this year. There's lots of great topics. It's a very accessible website. So we encourage you to take a look at this as well. I'd like to say thank you to Yvonne Smith and Jason Campbell, but also Danisha and Jackie as well for kind of supporting this webinar. We hope that you all have gotten a lot of information out of it. Our audiences, both non-public and LEAs and other stakeholders who may have joined us today. We will be in touch with you with the full copy of the slide deck and the audio recording once we publish that to the OSSE website. So this concludes today's webinar, and we look forward to connecting with you in the future. Thank you.